Hello, dear viewer. You are very much welcome to my YouTube channel, Health Awareness Tips with Dr. Mercy Kalenzi. Today, I'm privileged to share with you a topic that was presented to KBS Radio Kanungu District, to the people of Kanungu and everyone that listens to KBS Radio. I am sharing about hypertension. Yesterday when we went to the radio, we shared it in the local language, and the team that I shared with, I'll be able to show them up and give them and share with you their views about what they think you should be able to learn about hypertension. This team was from Nyakatari Health Center 3, which is a church-based facility under the Diocese of Chinchizi. I hope you are going to be blessed. Thank you so much for watching. So I want to first give you an overview about high blood pressure. These are facts that you and me, or you and your relatives, should know about hypertension or high blood pressure. So, according to the current research by the World Health Organization, it has been estimated that about 1.28 billion people worldwide are living with hypertension. So you see that is a very big number. And the research also estimates that about 46% of that total number of people who are hypertensive are unaware that they have hypertension. They don't know whether they are living with high blood pressure or not. And the research also suggests that about 42% of the population have been diagnosed and are on treatment for high blood pressure. The research also estimates that about 21% of the general population, of the number of people who have high blood pressure, are well controlled on treatment. So I would want to pose you a question. Are you among the 1.28 billion people who have high blood pressure? If so, are you among the 46% who are not aware of the hypertension as it is in their health? If you are aware, are you among the 46% who are diagnosed and are on treatment? And if so, you have been diagnosed with high pressure and you're on treatment, are you well controlled or not? I want to let you understand that it is very important that once you have been diagnosed with high pressure or high blood pressure, ensure that you get treated. If you are on treatment, ensure that you take your medication as prescribed and ensure that you are well controlled, because once you get high blood pressure, then your body, your health gets at a high risk of one, getting a heart disease, heart failure. Number two, getting a kidney disease. Number three, you are at a high risk of getting stroke. Number four, you begin to have issues with what we call peripheral arterial diseases. The diseases which affect your limbs, you find that you have a lot of pain, you have a lot of numbness. There's that chronic pain and tingling sensations that are in your limbs, and you're very uncomfortable with them. And also to some men, when the blood pressure is long-standing and not well controlled, they get to have issues with erectile dysfunction, which is not good for our health. So those are the facts that you need to understand about hypertension. Aware. So you need to know those complications so that you can take care of your health and also comply to treatment once you have been tried on treatment. Or else, if they have told you that your blood pressure is fine, then you need to also walk or have a good lifestyle that will prevent you from getting these chronic diseases. So here I am with a guest who was also on the radio, and we happened to present together about hypertension. I'd like him to take you through his code.
Oh, I'm Dr. Joe Kalenzi.
Okay, it's called Dr. Joe Kalenzi, also a medical officer at Nyakatari Health Center 4. So he's going to take us through about risk factors that can make someone or predispose you to have high blood pressure. And also, he will continue to take us through signs and symptoms, what you would think about if you have high blood pressure. Please, go ahead, Doc.
Oh, thank you very much, Dr. Mercy.
Thank you.
And I take pleasure in such an opportunity to be part of your show.
Thank you.
Thank you for the invitation. So, I know we are talking about hypertension, and she pretty much said everything. But regarding the risk factors, these are things that put you at risk of hypertension.
Okay.
These are things that you might do or you might overlook, and then they will put you a step closer to developing hypertension. And these risk factors are always categorized into the modifiable risk factors and the non-modifiable risk factors. And in the modifiable risk factors,
Doctor, someone would want to understand what you mean by modifiable.
yes. We mean the risk factors which you could do something about,
yes,
in order to change your outcome.
Yeah.
For instance, if you are a smoker, we already know that smoking puts you at risk of hypertension. And if you decide to quit smoking, then it is a modifiable risk factor. The non-modifiable risk factors are things that you can't do anything about.
Yes, please.
So let's start with the modifiable ones. Like I already said, we have smoking, cigarette smoking, but even people who do what we call vaping, they are at risk of getting hypertension because these chemicals have a way they interfere with the integrity of our blood vessels. So they stiffen, and that predisposes us to hypertension.
There's a chemical called nicotine in cigarettes.
Oh yeah.
Yes, nicotine.
So people who live sedentary lifestyles are at a very high risk, because the sedentary lifestyle is going to even give you a risk of gaining too much weight and ending up hypertensive. People who take too much salt, people whose diets lack enough potassium. Which other factors can you think about?
Stress.
Yeah, when you're working in too much stress, an environment which is stressing, or even if it's not work related, but maybe family issues, school and many other, they put us at risk. People who drink too much alcohol, we say alcohol is safe to a certain extent, but then when you use too much, then you put yourself at risk of hypertension. Even chronic diseases, things like kidney disease, will put you at risk of hypertension. So if you know you're at risk of a kidney disease and you get it treated, you find you've done well, and you distance yourself from hypertension. Other risk factors also actually include pregnancy.
Yeah, talk about it.
Some people who pregnancies always put women at risk of hypertension.
Yes, preeclampsia.
And if you've had a previous
history
of things like preeclampsia, then you're at risk of also getting chronic hypertension.
Yes.
So these are some of the modifiable things. Poor exercising habits.
Yes, people live completely no running, no jogging, no Simple things that you can do in the house. Yeah.
Then among the non-modifiable risk factors, we have things like your race. You can change your race.
That's true.
We as black people, we are at more risk to develop hypertension as compared to the other races. So people who are of black descent or African descent, when you're above 65 years, there is nothing you're going to do about that.
Talk about how the age affects your blood vessels and then you end up with hypertension.
Well, as we age, our vessels will be a bit more stiff and non-responsive to different hormones that tell our blood vessels to either expand or contract, given the prevailing situations. So when you have poor response of the blood vessels to the demands of the body, then you are at risk of hypertension. We've spoken about age, race. If you have a family predisposition, your father is hypertensive, your mother is hypertensive, you're at risk of hypertension.
Very much.
Though this, to a certain extent, you might try to, your family, you have a familial predisposition, you could try to
work on the modifiables.
Yes, work on the modifiables. Make sure your salt intake is low. Make sure you have enough potassium. You don't drink too much. You don't smoke. To a certain extent, you can modify it to a certain extent, but there are times when there is nothing you can do about it. Which other ones can you think about?
Well, let me stress about the modifiable and especially salt. People underlook the power of high salt intake. I mean, the salt you take with that boiled egg, the salt you take in the popcorn, the salt you take in the roasted nuts, and also your daily intake of salt in the foods that you eat can predispose you to high risk factor. I mean, to getting hypertension very badly. Because when you take too much salt, your body is able to retain a lot of fluid. And this high amount of fluid in your body will now put more pressure on your vessels. At the end of the day, your kidneys are going to be affected, and it's going to be so difficult for it to excrete because over time it's dying out. And this high fluid that has been retained now will give you high blood pressure, because the vessels will need a lot of pressure to be exerted and push this water out of the body.
Speaking of salt, it also encompasses people who like fast foods or packed foods.
Yes.
Those ones really, really carry a lot of salt. Things like crisps and the likes. They are always packed with a lot of salt. Other packed foods, we know salt is a preservative. So those people who take foods that are packed and preserved with salt, you're taking a lot of salt. And in the long run, you end up hypertensive.
That's true.
So I think we should talk about the presentations.
Okay. Talk about that thing of hypertension as a silent killer.
Oh, from experience, when someone is hypertensive, they won't know. That's why we actually need to do regular checkups, especially when you reach a certain age, or if you know you have a risk factor like family predisposition. We are supposed to do regular medical checkups. And it's very fortunate that blood pressure measurements are free. It's a free service in most of the centers, and the monitoring devices are cheap.
That's true.
So some people can have them at home. hypertension is a silent killer, like the way you said.
You won't know that you have
won't know.
hypertension until you are now in the late stages.
Oh yeah, by the time
you present,
you start showing signs and symptoms, most of the time it is late, and some of the time it is too late.
And you know, sometimes someone will present you when they already have a stroke.
Oh yeah.
You just check for the very first time, you find their pressure is just too high.
Oh yeah.
Maybe they are unconscious, or they are confused, or they already have one part of their body paralyzed. And it's the reason why we say it is a silent killer. It kills you quietly without any major sign. So by the time you know it, it's really in the late stages.
It does not have constitutional
Symptoms. Thank you.
So, but people who have it sometimes will present with a headache.
Yes.
That has been disturbing them.
Very persistent.
They present with dizziness, palpitations,
racing heart
is racing. Sometimes they find they are having chest pain, okay, easy fatigability.
Yes, please.
You find your memory is shaky. Sometimes they are confused. And when things are bad, they will come and present to you in a state of a stroke, or what we call a transient ischemic attack.
Yes, yes.
And that's the worst case.
The doctor talk about the eye problems.
Yes, we know because of the high pressure, we are going to get damage of the veins in the retina. So most times people will come and they have issues with vision.
Doctor, I can't see well.
People will come with issues to do with the kidneys.
Yes.
But most of these now are complications.
Yeah, yes, they present when they already have those
most of the time they present with complications. So it is always good to do regular checkups, so that once it is found that your pressure is elevated, you go on management. It might be lifestyle, with chemotherapy. So those are some of the signs and symptoms we can talk about.
Thank you so much. Thank you so much, Doctor. You have actually exhausted most of them. Only that we also need to add that some people will get issues with their limbs. They get numbness. They get those tingling sensations.
Features of peripheral
arterial diseases. So by the time you check their blood pressures, you find them very high. And also for some men, not everyone who has high blood pressure, but for some men who have had high blood pressure, maybe long-standing and not on treatment, they can get issues with erectile dysfunction. Somebody comes before you, their problem is, doctor, I can't sustain this for long. Only to take their history, to do their medical checkup, the blood pressure is too high. And yet they have been living with it for a very long time without knowing. So it is very important that we emphasize the issue of routine medical checkup. So doctor, let's talk about management. And this management entirely look at the modifiable factors. So when we talk about modifiable factors, my friend, these are things that you can do on your own without somebody pushing you to make sure you stay healthy. Because once you have this high blood pressure in your body, you know it's not reversible. You're going to suffer for the rest of your life. Maybe if you have relatives who have had high blood pressure, you know what they go through. They get heart failure, their body is swelling now and then, they have difficulty in breathing, they are so tired for any small activity they do. So we want to see how best you can work on the modifiers to make sure you reduce the risk of getting high blood pressure.
And among the modifiables,
salt intake. Reduce your salt. Ensure that you take little salt. Minimize it as much as possible.
A good diet.
A good diet.
All right. You reduce your fat intake.
Size of the plate and the fat intake.
Okay. Yes.
The C-class chips. Those C-classes. So we need to reduce the amount. Yes, don't take it every day, night, evening, breakfast. It's not healthy at all.
Reduce on the refined sugars. Reduce on the sedentary lifestyle.
Yes.
Exercise at least 30 minutes daily. For those who are too old, they can't run.
They can't run.
Brisk walking. Watch your weight. Make sure that you do not become overweight.
If you
make sure the circumference of your abdomen,
your waist
is not greater than half
of your height, doctor.
Some people have a circumference of the waist that is greater than half their height.
Okay.
And that doesn't only predispose you to hypertension, but it will also give you metabolic syndrome.
Yes, metabolic syndrome is very common with people who have high blood pressure.
Oh, yeah. So,
stress management is a key in actually reducing hypertension. Confide in someone, open up. It's very important. Don't just die with with stress without sharing. A problem once shared is half solved. So share with someone and ensure that you work on your stresses. Yes.
And you also ensure you manage other conditions that you might be having.
Kidney diseases.
And that will help you not to develop complications, which include hypertension.
Yes, so that is true.
If you have dyslipidemias, you don't wait to the extent of getting atherosclerosis and hypertension. If you have kidney failure, if you think you have thyroid problems,
go and manage them.
Those are manageable things. And but sometimes the lifestyle modification alone does not
help.
Take away. Though to one extent it helps. We spoke about salt. We forgot to talk about the smoking. We forgot to talk about the alcohol.
Stop the alcohol.
Reduce the alcohol.
Doctor. Okay, reduce the alcohol. Reduce the alcohol intake.
You don't want people to get withdrawal
symptoms. So you're telling them to do a little symptom. Okay.
So reduce your alcohol intake. Alcohol is actually toxic to the heart.
I know.
Okay. But it is also good for the stomach. According to the Bible.
Okay. Some simple 10 minutes of wine now, okay?
Yeah. A glass of wine. I think they say those are around 30 minutes of ethanol or something like that.
Okay. So, doctor, we're saying people should engage in daily exercises. They should reduce salt intake. They should stop smoking, eat healthy diet, do good exercises, do some jogging, do some cycling, do some rope skipping. Seek medical attention before you worsen. It is important for anyone to at least make sure if you can't do monthly reviews, do every 3 months review, quarterly. Go for a medical checkup, find out from your healthcare provider, check your sugars, check your blood pressures, see how you're generally doing, weigh yourself monthly. Don't wait when you're 100 to be on tension to reduce every day. Make sure every month you weigh yourself and see how much you have added, also how much you have reduced. These things keep us very encouraged. If you can't do it alone, do it with a team. Do it with a team. We encourage you to drink plenty of water. At least 5 to 8 glasses if you can. It's very healthy. A diet with vegetables and fruits is very paramount.
It's healthy, but if you have complications already with hypertension, then you go easy on the water.
Yes, all right, good, thank you. Those with already heart failure.
You go easy on the water. Because now we don't want you to get water
overload. so heavy. It can also give you difficulty in breathing.
And the medical management,
No, medical, as long as you have been diagnosed with high blood pressure, we encourage you to seek healthcare provider and ensure that before you take any medication, your healthcare provider has rechecked your blood pressure and you know how much drugs you're taking, for how long. You take note of your monthly reviews, which is very, very important. And doctor, you need to tell those people about counter drugs, buying drugs from pharmacies.
oh yeah. Anyway, I always educate my patients. As a medical worker, I believe patient education is key to management of certain conditions. A patient with hypertension is a patient with a chronic disease. They are supposed to become what we call an expert patient. They are supposed to know their condition. So I always urge patients to actually know their condition, understand it to a certain level, and know their drugs. And this helps the patient to follow up on themselves. It helps the patient to know that they are supposed to have their blood pressure checked regularly, even when they are taking drugs. They are supposed to know the classes of drugs they are on, because some patients come, ask them, they'll be like, I'm taking one big tablet
It's white.
and one small tablet.
And you don't is it Panadol and the aspirin.
This is for hypertension. And you're like, do you have the books? No, I forgot those things at home.
Yes.
And then this now gives you a challenge, because it's also not so good to always change the drugs
every month.
all the time. So it's good for you as a patient, or you as a caretaker for a patient, to know exactly the drug that your patient has been on. Because in the medical management, we want to start you on one drug, monitor you. If one drug is not helping, we step up the dose.
Yes, we step up.
Then we reach a point of adding a second drug.
If you are not,
if the maximum safe dose for the first one is not helping. So we find a challenge when you find this patient has had their doctor reach a certain point on management, and one day they come to you and they do not have the medical records, they do not know the drugs they are on, and you start afresh. Or you overreact.
That is true.
So and it's not good. You find maybe the drug they needed a refill for them to be fine, but now they don't know anything about the drugs they were taking, and now you start afresh. Okay, and then you have to start checking with them again, and trying to taper up and taper down and adjust the doses.
And financially, it's
and
not
stressing the patient financially.
Yes.
So it's a very important thing for the patient to know the condition and know the drugs they are on, so that at any time you ask them, are you hypertensive? Yes. Which drugs are you on? I'm on modification and bedrock. All right. So we continue management. Even in the hospital, you came because you have malaria, or
manage your malaria and
manage
you go back home.
with hypertension.
So doctor, patients should understand the advantages of monthly reviews, because to them it helps them to track their disease progress. Because a patient who came last month and they told them this pressure is not well controlled, maybe it is 200 over 100. Next month they tell, now when you recheck, maybe they're like 160 over 90. It's something beautiful to them, because now they have kept track. Okay, that time I had very high blood pressure, but now it's coming down, which encourages them It gives them confidence about the dosages of drugs that they are taking. Because you understand some patients have different boxes of drugs which have the same names. She buys 3 boxes of nifedipine and then different brands, and then she's taking the same drug every day, and of course different classes. So you find that one patient is on same classes of drug but taking a very high dose. And you know, it happens with those patients who their relatives from very far are sending them drugs at home. So it would be important if they come for review with their drugs, then you tell them, no, this drug is the same as this one. So first finish this, keep taking maybe 1 tablet. Then when it is done, you can go to another one. So we encourage also the relatives that when you're buying these patients' drugs, take care in explaining to them, or tell them reach to the nearest healthcare provider and they guide you on how to take these medications. Something that is very important with the monthly reviews is patients reduce the recurrent admissions in the hospital. You find somebody takes 5 months without having any reviews, but by the time they are coming, they are maybe having an acute stroke, a transient ischemic attack. Before that, they are coming with a hypertensive emergency the next month. And you know, every month you're coming in the hospital in emergencies, spending a lot of drugs. It is emotionally disturbing. So all these things make you uncomfortable. It makes the attendants, the caretakers, I mean, they get tired of these diseases and they are worn out emotionally. So these are things that the reasons why you should make sure that you get monthly reviews. So thank you so much, Doctor.
Oh, my pleasure to be here.
For being part of this discussion. I'm so grateful. Thank you for having your time to go to the radio. We have brought this closer because we understand some people miss to listen to the radio. So we hope you benefit from this, and we wish you a Merry Christmas and a Happy New Year. Please enjoy, and please, if you're coming for any reviews, come. You will find us at the health center, Yakatari Health Center 3, and we'll always be ready to take care of you. Till the next video. Bye.
Bye-bye.
See you.